Hey everyone, today we're going to be going over diagnostic ultrasound for the long head of the biceps tendon. First things first, looking at the anatomy. So the biceps tendon long head itself runs up the humerus and inserts into the glenoid labrum and the supraglenoid tubercle. It travels through the bicipital groove on the humerus, which is made by the greater and lesser tubercles, as you can see in that middle picture there on the screen. To palpate the long head of the biceps tendon, you're going to find that bicipital groove on the anterior shoulder. You're going to place your thumb on it, and then you're going to internally and externally rotate. So you slide to and from the greater and lesser tubercle on the humerus. This is going to be a palpably tender spot, so you'll know you're on it when the patient says that they have a little bit of tenderness with palpation. Positioning for it, so we can look at the long head of the biceps tendon in a transverse view or a long axis view. So for the transverse view, the patient is going to be seated and they're going to be relaxed. We're going to palpate that long head of the biceps tendon, and then we're going to place the middle of the probe right on that spot. The marker on the ultrasound probe itself is going to be facing the patient's right. For the long axis view, patient's still going to be seated. They're going to be in a relaxed position. And after we palpate, the probe is going to be placed on the middle of that long head of the biceps tendon where we just palpated. And the marker is going to be facing towards the patient's head for this long axis view. Looking at the transverse view picture of the long head of the biceps, circle number 1 is that tendon itself. So that's going to be hyperechoic. We see the greater tubercle of the humerus and the lesser tubercle of the humerus. So the bones itself are going to be hyperechoic, and it's going to have that reflective aspect of it since we have bones, and bones are a little bit reflective. So we know that ultrasound waves do not go through bone, they just bounce back. So we see that reflectiveness in the picture. For the long view, we're going to see that tendon run along right here. And then that is what goes through the greater and the lesser tubercle on the humerus. Looking at some videos, we have a long axis view, the long head of the biceps tendon on diagnostic ultrasound. And then we have a transverse view of the long head of the biceps tendon. So you can see the greater and the lesser tubercles and then that long head in the middle of it.